So Dr Laurence Kemp studied medicine at the University of Cambridge, UK, graduating in 2005. Following practice as a specialist GP, he went on to become medical director for a group of primary care clinics. In 2018, Laurence moved to Brisbane with his family, and this is where he first developed an interest in medicinal cannabis. Laurence now leads the Cann I Help group of clinics, as well as continuing to work part-time as a GP and sitting on the Brisbane South PHN Clinical Advisory Board. He passionately believes in improving patient access to cannabinoid medication through education and improved clinical research, as well as working with producers to reduce financial barriers. Welcome to Pure Health Hub, Laurence. Thanks for joining us.
Oh, my pleasure. Thanks for having me.
Pleasure indeed. Now, the World Health Organization reports that anxiety disorder or disorders are the world's most common mental health condition, with apparently 1 in 13 people globally suffering with one or more. So what are the most common types of anxiety disorders?
Yeah, so I certainly agree that it's something we see very, very commonly in clinical practice. Anxiety disorders have been categorized into multiple different subcategories. Look, I would say in my clinical experience, there's often quite a lot of overlap. So often it's very difficult to say someone fits purely into one category. They often have features from both. But in terms of what are the most common, then probably the big three that we see would be generalized anxiety, which is just that kind of low level feeling of anxiety, which lasts all day and is always in the background and not particularly situation specific. And then we get panic disorder, which is the variant where patients get panic attacks, which can be triggered by specific instances or can come on kind of out of the blue, and that can be really horrible and really disabling for people. And probably the other one we're seeing more and more commonly at the minute is social anxiety or social phobia, which is an anxiety which seems to be particularly related to social interactions, whether it's going out to the shopping centre or mixing with people at work or things like that. So I'd probably say that those are the three we're seeing most commonly. But as I said, I often find people that have elements of kind of more than one within their presentation.
Yes, indeed. I happen to agree. When I was doing research for this, I almost pointed out about 5 of the ones that I could relate to. So there are a number of them, and you're not always, categorized by one necessarily. Now, there is a lot of talk about CBD and how it can assist with anxiety disorders and pain and things, but anxiety is where I want to focus. Now, I know it's certainly done a lot for me, but how does CBD help with anxiety disorder?
Yeah, so on a kind of biochemical level, we all of us make our own cannabis-like compounds within the body that we call endocannabinoids, or cannabis that's produced by the body. The major mechanism by which CBD works is it stops the body breaking down these compounds we make ourselves. So we produce these compounds called anandamide and 2-arachidonyl glycerol, which are the major endocannabinoids. And usually these would be produced by cells throughout our body. They'd last for a very short period of time, and then our body's own enzymes will break them down and inactivate them. And so one of the main mechanisms by which CBD works is it prevents that. So the chemicals we make ourselves just hang around that little bit longer, so they have a little bit more time to act and can do a bit more of a job, really. So that's the main mechanism.
Wow, that is the first time I've heard that explained that way. That's fascinating. So we already produce, so it's a complementary element to.
Yes. So look, when we just, without going too much into the history of things, we obviously, first we discovered THC and CBD back in the 1960s. It wasn't until the 1990s that we worked out how these plant chemicals interact with the body. And then obviously, the body didn't evolve a number of receptors just to work with plant chemicals. And so since then, over 100 chemicals that the body makes itself what we call the endocannabinoids have been identified, and we've started to research this whole system that goes on with the within the body of our own cannabinoids interacting with these receptors. And so CBD and THC as well interact with this system, and the interactions are quite complicated. So CBD actually probably works in many different ways, but perhaps the major way is it just potentiates the effects of our body's own natural chemicals there.
That is fascinating. That's brilliant. I had not heard it explained that way. I didn't realize that we had it within us as well. Okay, well then, what are the administration methods? I hear about all these sorts of different methods, oils and tablets and various things. What are they, and what do we have available here in Australia?
Yeah, so these are developing all the time, actually. So traditionally, the main ways that we gave medicinal cannabis was in an oil form, where you put the oil under your tongue, you hold it in your mouth, and then you swallow it. Part of it is absorbed through the mouth, and then the rest of it's absorbed through the stomach and the gut. Or the other way to take a cannabis medication was to inhale it. So you'd heat up the flower and inhale the vapors, a kind of medical form of smoking, although we never recommend smoking with our patients. It's always vaporizing. Since over the last 6 months or so, a number of the cannabis companies have come up with other novel ways. So there are now a variety of sprays that you can spray under the tongue. They've developed rapid acting lozenges that you can put in your mouth, and they dissolve a bit like a kind of migraine tablet. Now people have even developed topical creams that you can rub on and things, and and other ways of getting them into the body. But essentially the main routes remain either swallowed or inhaled. But there are a few variations that are being developed at the moment.
Yeah, they seem to be coming up. This segment really seems to be coming ahead in leaps and bounds. The discoveries, and as you say, I mean, that may have been something that's been around, that's been known for some time in terms of how the CBD helps us, but getting this out is really important so people understand how it works, because I think we're just going, oh, it's something that someone tells me works, and let's have it, rather than understanding the real reason for it. So that's fantastic. Now, are all of these administration methods available, or are these products available in Australia through, obviously, clinics? Or are they,
Pretty much all of them are available in Australia now. If we'd had this discussion 6 months ago, I'd have said, look, it's just the oils and the flowers, but actually most of them are available now. They're still only available, so they need to be on prescription from a doctor, and they need to be accessed through the TGA's special access scheme. So there are still some restrictions around them. I mean, it's really interesting that other countries in the world are taking a much more relaxed approach. So the UK, where I come from, has classified CBD as a food rather than a medicine. So it's freely available. You can get it in supermarkets and things like that. But Australia is still taking this slightly different approach. So it's still only available on prescription. There is hope that possibly within the next year that CBD only products may be available from the pharmacy directly, but at the minute it still requires a prescription from a doctor.
Yeah, that was going to be my next question. Do we have any end in sight? I mean, obviously it's been approved for sale, but the product hasn't been approved for sale, right? So
yeah, so we was at a conference last weekend actually, and there are a number of people that are, in order for it to be approved for sale as a product, it just has to, there are a few more regulatory processes it has to go through that require quite large scale studies to be done. And these studies are underway. But they usually, a study like this takes a couple of years to get to the stage where the results come out. And so I think probably we're still 12 to 18 months away from being able to buy these things without a prescription.
Wow. And, sadly, it sort of creates these black markets and things, which, and food, as a food in the UK, that is interesting. That is
so it's all kinds of products are available there. And as I say, you buy them from your supermarket or your pharmacy. No prescriptions needed. I think that's a slightly radical approach. Now, I'd probably be in favour of it being available from a pharmacy as a medicine in Australia. I don't think we need to class it as a food. It's incredibly safe CBD. But the one thing that I always do warn patients about is it does interact with quite a lot of other drugs. And so it's always worth if you are taking, this, obviously if you're having it prescribed, going through everything else you're taking with your doctor to make sure that the CBD won't do you any harm, really. But potentially what you don't want to do is mess up the levels of any other medicines you might be on.
Yeah, well, that was actually one of my questions, actually, because I think, we often forget about any interactions between natural and pharmaceutical and obviously CBD. So you still recommend that obviously you have your doctor look at that. Are there, we're just going back to the methods, are there any more effective than others? Absorbed more quickly or anything like that?
Yeah, so I think when we look at the different methods of administration, there's kind of two factors that we would look at. So firstly is the speed of onset, and secondly, there's the amount of it that ends up in the bloodstream. Now, certainly the oral route, stuff that you swallow, is generally absorbed quite slowly. It sits in the stomach for a while, depending on how much food there is in the stomach at the time, and then it's absorbed. So typically with an oil that you swallow, you'd be talking an hour or two before you get the maximum level within your bloodstream. For some of the sprays and some of the lozenges that get absorbed through the lining of the mouth rather than through the stomach, you may be talking kind of more like 15 or 20 minutes. And for products you inhale, it can be as fast as 5 minutes. So it's the difference in the speed of onset. The other thing is that depending on where it's absorbed from makes a big difference. So if it's absorbed through the lining of the mouth or from the lungs, it goes straight into the circulation. And so you get quite high levels within the blood. If it's absorbed through the gut, everything that comes through the gut goes through the liver before it reaches the main circulation, what we call first pass metabolism. And the liver's actually quite good at breaking down cannabis and getting rid of it. So you get a much higher level in the blood through other routes as opposed to the kind of swallowed route. So the dose of a medicine that you need to take if you're swallowing it would give you less of a peak in your bloodstream than the equivalent dose that was inhaled or taken through other routes. So,
wow, okay, I didn't realize that. So taking it under the tongue is going to take longer and perhaps be more diluted.
So yeah, under the so something absorbed through the lining of the mouth, you'll probably get higher levels in the bloodstream and it'll be quicker. A swallowed oil probably takes the longest. And if you were to vaporize a CBD strain of flower, that would probably get you the highest dose and it would work the quickest. And obviously the preparation is dependent on the condition. People with generalized anxiety probably do quite well with taking an oil 2 or 3 times a day and having a constant level in their system. I've got some patients with they may have anxiety related to public speaking, and so actually having having one of these quick release preparations that they take 15 minutes before they go into their meeting or before they give their presentation can work really well for them. So it's very geared to the specific issue.
It can be, can't it?
Yeah.
So you do recommend it for someone like that as well, to calm the nerves. I mean, who doesn't fear public speaking? So, they could probably relate to everybody, but that's interesting. So you can take it for, as you say, a social anxiety or something.
Yeah, absolutely. You can take it on demand. And look, I have a lot of my patients take it every day, but I have others that, it may just be kind of as and when they're needing to do something that they know is going to trigger their anxiety. Maybe it's going on a flight, maybe it's public speaking, maybe, it's having to go to a crowded environment like a party, or, go out on a busy day at the shops and things like that. And they can use it to manage these challenges as they come up.
Well, they say that COVID has brought on a lot more social anxiety because of the time spent in isolation. So, maybe there's another element there. Now, okay, while we're on that subject then, so the risks or side effects, what are there any, and what are they like potentially?
So CBD itself is extremely well tolerated. So in lots of the big studies that have been done on CBD, even at very high doses, they showed the rate of side effects within the group taking CBD and the rate of side effects in the group taking the placebo were pretty much the same. So there aren't a lot of side effects associated with CBD. the main ones that we do see may be more related to the oil that it's taken in. So traditionally, if you take an oil, the cannabis oil is dissolved within within another oil, and that may be olive oil or coconut oil or sunflower oil or something like that. And so some patients get a little bit of an upset stomach related to that. But look, generally CBD is very free from side effects and very well tolerated.
It's almost magic. I don't want to make it a cure-all, but it's quite extraordinary. Okay, so then we hear about full spectrum, isolate. What is the difference between those two, and what do we prescribe here in Australia?
Look, that's a really, really good question. So the way I explain it is a full spectrum oil is an oil that contains every element of the cannabis plant, including some of the THC. So a full spectrum CBD oil would have large amounts of CBD in, but also would have small amounts of THC and the full spectrum of all of the other, what we call the minor cannabinoids and the terpenes and the other chemicals in there. So full spectrum oils are great. They generally speaking, if you get the right one, the levels of THC within them are very low. So they're not oils that would make you feel high or sedated or anything like that. But the main downside with a full spectrum oil is they have some THC in, which means that potentially if you were pulled over at the side of the road, you could test positive, even though the levels are very, very low. And I talk to my patients, it's the equivalent of having a tablespoon worth of wine and then going out and driving. It's not going to impair your ability to drive whatsoever. But because the rules on driving are that you can have none whatsoever, it's still a risk there. An isolate is essentially an oil that's been either distilled or filtered in some way to remove almost all the THC. So the real advantage of isolates is that patients can take them without any worry about their ability to drive whatsoever. If they have occupational tests, then there's no worries that they'll return a positive result there. And I've got certainly plenty of truck drivers and even some commercial pilots who use isolate products for that reason.
So that's the key.
The downside with an isolate is obviously the process of distilling or filtering it can sometimes remove some of the other beneficial chemicals. Sometimes they can then be added back after the distillation process, but not always. So generally speaking, I always prefer to go for a full spectrum if I can. But if people need to drive or they're subject to occupational checks and things, then sometimes an isolate can be more appropriate.
And you know what? You've just explained it to me. I am obviously then on an isolate, so which has never been explained to me. So because I just didn't want that hassle with the THC thing. So that's interesting. All right. So that's the clarity behind it, because there's a whole lot of stuff on Google that really doesn't explain it at all. Thanks for that. All right. So, okay. And then I was going to ask, I was going to talk to you about those interactions with other medications, but it's really just best to talk to your doctor who's prescribing.
Yeah. I mean, there are a few higher risk drugs. So I think, particularly warfarin, that's a drug that interacts with almost everything. But the other kind of broad groups of drugs that we'd be focusing on there are epilepsy medications, particularly drugs like carbamazepine, or Tegretol is the common brand name for that. And then certainly anyone who's taking antiretroviral medication for HIV, or people that are on immunosuppressant medication because they've had a transplant, those are very, very high risk groups, because those interactions those drugs tend to interact with CBD in a very significant way. So I think the message there is always check with your prescriber. It's worth going through all of them. Most drugs we can find a way around it. For patients on warfarin, it's often just a matter of having slightly more frequent blood tests for a couple of weeks, so that there's usually a way around it. I don't think I've ever had to say, look, we can't prescribe for you, but sometimes we've had to adjust the doses of some of the other drugs that they're on a little bit, just to anticipate that interaction that might occur.
Okay, so there are workarounds, so that's good to hear. So we don't need to just cut it off entirely. Is there anything that you're familiar with in terms of natural, supplements or things that people are taking that could potentially, stand out?
Yeah, so look, another natural product that works on the same liver pathway, St. John's wort, which a lot of people take for depression and mood, and that interacts with the same pathway in the liver that the cannabis medications do. So that's probably the main one I'd mention there to look out for.
Yeah, I've heard that has some interactions with a number of things and even antidepressants and things like that. So, that has been an eye-opener. Thank you, Laurence. I'm so pleased that we got to talk about the anxiety element and opportunities and benefits for people suffering anxiety and with CBD. So I want to thank you for joining us with that and sharing those insights. Appreciate it.
No, my pleasure. Thanks very much.